Ma'am, shall we start, ma'am?
Yes, please.
Yeah. So, very good evening, doctors. I am Dr. Stalin on behalf of Shield Healthcare, welcoming you all for today's webinar. So, the topic for the day is PCOS and gut dysbiosis. And I welcome the participants and I request them to post your queries in the comment box so that we can have a short Q&A session at the end of the presentation. And now it's time to introduce our eminent speaker for the day, Dr. Mala ma'am. Madam has completed her UG from Kilpauk Medical College and the post-graduation diploma from SRMC. Madam has done her endoscopic diploma in endoscopic surgery and reproductive medicine from University of Kiel, Germany. Madam has undergone aesthetic gynecology training from South Coast Urogynecology, California. Madam is currently the managing director of Firm Hospitals, Chennai, and secretary of IAG Tamil Nadu chapter. Executive Committee member OXY 2017-2020, past secretaries of IMS Chennai chapter 2010-12, a Fox endoscopy trainer. Madam has received her best doctor award from Tamil Nadu MGR University, Times Healthcare Achievers Tamil Nadu 2018 award for Star World in OBG, and operating faculty in various conferences, and Dr. Shuli Rudra Sinha award for best paper in gynec endoscopy at AICOG 2006 Cochin. With this introduction, I welcome you, ma'am. Ma'am, before going to the section, I will take 1 more minute of your time for sharing our Shield Connect web page, ma'am.
Sure.
So this is our Shield Connect web page, ma'am. So it contains lot of scientific information related to the women's health in our website, and you can see a separate page for the blogs. You can see n number of blogs written by our doctors to share their research and thoughts and advice through their blogs. Madam, I request you to share some blogs if you are interested to be. We will be happy to post it in our website, ma'am.
I'll
And
do that.
yeah, ma'am. And we also have a separate page for webinars. All our webinars are conducted through our Shield Connect web page, ma'am. And you can see the details of upcoming webinars, and you can see the details of all past webinars which we have done in the past 1 year is available in our website, ma'am. And we also have a separate page for PCOS awareness. So you can see short videos of doctors explaining about PCOS in various regional languages, which is also available in our website. And we also have a separate page for our leaders. We have more than 220 doctors who are supporting our web page through their webinars, and we also have a separate page for the speakers who are our speakers, which is available in our web page, ma'am. And you can see your just you can click the name and you can see the speakers website, ma'am. So you can see all the webinars which you have been supporting us in our website is available in our website, ma'am. So I request the participants to go through their the website and make useful of it. Thank you, ma'am, and over to you, ma'am.
So let me share my presentation. Thank you so much, Dr. Stalin, for the warm introduction. Of course, your page looks very good. So I think I should also contribute some for the blog. Okay, so today, good evening, everybody. Here we are to talk about a novel therapy in the management of PCOS, that is the microbiota. So it is quite interesting to know that the gut dysbiosis has been found to be a major factor for the development of PCOS. So here the presentation is going to be totally focused only on gut dysbiosis in PCOS. The other aspect of PCOS are not going to be discussed, because PCOS per se is a very, very vast topic. So we will stay focused only on gut dysbiosis and PCOS. So as we all know, PCOS is a complex endocrine and metabolic disease, and several PCOS-related genes have been found to be associated with the carbohydrate metabolism and the steroid pathway, suggesting that there is a very important correlation between the metabolic factors and the pathological mechanism in the development of PCOS. So we have evolved quite a lot in the understanding of PCOS right from the time Steen and Levital described this condition way back in 1935, ever since they did a wedge resection of the ovary. So lots of theories have come in, and lots of pathogenesis for the development of PCOS have been now brought to light. And the current is the gut dysbiosis in the development of PCOS, which we are going to look at. So of late, the correlation between the gut microbiota and the metabolic diseases have become a very hot topic in research, and this leads to a number of new ideas about the etiology and also the pathogenesis of PCOS. So what exactly is this microbiota? So the microbiota is nothing but it is just a collective term for all the organisms which are present in our body, mainly the intestines, whereas the microbiome is the genome of these organisms. It could be either a symbiotic or a pathogenic, which are staying in our body. So generally with environmental conditions, they link these host and the microorganism, creating the problems or the benefits. So as we all know, the incidence of PCOS is really on the rise, and India is not only a capital for diabetes, now it's also become the capital for PCOS. Why? Mainly, as we all know, it is because of our faulty lifestyles. Apart from that, it is also understood that our genes also play a very major role, but we cannot just put the blame on the genes. So there is a constant crosstalk between the gut microbiota and the host that is mainly responsible for PCOS by causing inflammation, and it also causes insulin resistance and hyperandrogenemia, which ultimately results in PCOS, and it becomes a vicious cycle. So in PCOS, as I mentioned, though gene is a major factor, the lifestyle pulls the trigger, and here our trigger are mainly faulty eating habits and sedentary activities. So apart from that, the pathological stresses also plays a very major role, and now it has been found that PCOS is a disease of fetal origin. So right from the mother, the baby is in the mother's womb, the PCOS starts developing because of the hyperandrogenic environment which the fetus has been exposed to because of the mother being a PCOS prior to her conception. So at the time of menarche, with other psychological stresses and the faulty lifestyle, she kind of develops into a full-blown PCOS patient. So the main crux in PCOS, of course, is the insulin resistance, which results in excess secretion of insulin. And as a result, glucose remain unutilized in the circulation because of the resistance. So, and the insulin is not being sensitive for the breakdown of these glucose. So the glucose circulate in the system and it kind of gets deposited in the fat, resulting in obesity. And with obesity, of course, all the inflammatory functions starts in, you get to secrete pro-inflammatory cytokines and the free fatty acid. All these causes a chronic low-grade inflammations, and it results in all the consequences of PCOS. Of course, the maternal environment of hyperandrogenemia cannot be overemphasized in the development of PCOS, which is the hallmark in the development of PCOS in the adulthood. So various studies now have come in and they have done quite a lot of research regarding this microbiota and the development of PCOS women. So it has been found that in a women with PCOS, the gut microbiota has been found to be relatively less compared to that of a normal individual. And the research scientists have put in quite a lot of effort and study to discover this, which is kind of being looked into and adding more value in our treatment protocol. So it has also been found that the various parameters like the sex hormones, the metabolic parameters, and also the gut-brain connections have also been disturbed in women with PCOS with reduced gut microbiota. So our focus is mainly to increase the gut microbiota so that we could also get the women become sensitive to these insulin and kind of reduce the insulin resistance, and to some extent we'll be able to handle the PCOS. So the various factors act on the gut microbiota, the host factors. Of course, the genetic is the main one, then followed by the environmental factors like faulty eating habits, and of course, the rampant use of antibiotics, the hygiene, and also the probiotics. And all this ultimately affect the immune system, which cause so much of dysfunctions and the endocrine disturbances. And apart from that, it also found to be affecting the calcium balance. So that is the reason it has been found that even in post-menopausal women, the gut microbiota have been found to be doing a very major role. So they cause a disturbance even in the bone metabolism and also cause so much of vulval dystrophy and the vaginal and vulval atrophy, which is also a major issue in the postmenopausal women if the gut microbiota has been found to be reduced. So this is a very interesting theory which has come up in case of PCOS. That is, in the development of PCOS, this is a very novel therapy, which is the gut dysbiosis. That is, this is a DOGMA is dysbiosis of the gut microbiota, and quite a lot of light have been thrown on this theory. Now let us understand how exactly this theory works. So the microbiota hypothesis for the development of PCOS is the DOGMA theory, wherein the disturbance in the bacterial flora present in the intestine which is mainly brought about by faulty eating habits, increases the gut mucosal permeability. That is, it causes a leaky gut, and this results in the passage of lipopolysaccharides from the gram-negative colonic bacteria into the systemic circulation. So as a result, what happens? We'll have endotoxin, which is being secreted into the systemic circulation, and this affects the immune system, which in turn interferes in the insulin receptor function and increases the insulin level, which increases the ovary's production of androgens, resulting in hyperandrogenemia, and also interfere in the normal development of the follicle. That is, it results in defective folliculogenesis. So this is exactly how it works. That is, a faulty eating habit because of the high glucose and the obesity, the high fat, the low fat diet, and the fibers. All these will have an imbalance on the intestinal flora, that is the gut microbiota, which causes an increase in the permeability of the epithelial cells which are present in the intestine. And as a result, the endotoxin leaks through these epithelial cells and come back into the systemic circulation. And this affects the immune system, thereby interfering the insulin receptor function, and promotes the secretions of the testosterone. That is, an androgen environment is increased, resulting in defective folliculogenesis. So this is the mechanism by which the DOGMA theory works to explain PCOS. So the gut microbiota can cause insulin resistance, hyperandrogenemia, chronic inflammations, and metabolic syndrome, and contribute to the development of PCOS by various mechanisms. One among them is the energy absorption. Then it is also by the short chain fatty acid, lipopolysaccharide production. Then it is the choline and the bile acids metabolism, and also by intestinal permeability and gut brain axis. And let's look at them one after the other. Torres et al. Has studied about 73 patients of PCOS and found that compared to the normal women, patients with PCOS, they have fewer gut microbiota, and this was mainly due to the increase in the androgens. So to study the effect of the gut microbiota on the host PCOS phenotype, the feces from the patients with PCOS and that from the healthy women were transplanted into two groups of mice by oral lavage. So this the effect of the gut microbiota, which was present in the PCOS, now has been studied in the mice, which is quite interesting to understand that compared to the control mice, the mice transplanted with the fecal samples from the patients with PCOS, they developed insulin resistance, decreased corpus luteum, high testosterone, and also high LH levels. And mice given fecal transplant from PCOS patients gave few liters compared to that of the control. So this experiment shows that gut microbiota may be involved in the occurrence and the development of PCOS. So what are these probiotics and the prebiotics, which are the gut microbiotas? So the probiotics are the live microorganism. When administered live may be beneficial and they do not alter the pathogenesis, whereas the prebiotics are the non-digestible ingredients which selectively stimulates the growth of the beneficial bacteria in the colon. So let's have an overview about this gut microbiota. So under normal circumstances, the bacteria in the gut maintain a delicate dynamic balance to prevent the development of various diseases. So a range of diverse factors can lead to the changes in the gut microbiota, including the age, advancement of the age, faulty eating habits, diet, and the rampant use of the antibiotics. So with increasing age, the beneficial bacteria in the intestinal tract decreases while the toxins produced by the harmful bacteria increases, leading to the accelerated aging. So diet is the one of the most influential factor for the gut microbiota. So it is interesting to understand that the micro or ecosystem of the human gut microbiota is very diverse and dynamic and consists of about 1,000 to 1,500 species of bacteria, around 100 trillion bacteria in all, which colonize the human intestinal tract, and human inherit roughly around 20,000 coding genes from their parents, far fewer than that of other species. So this is in contrast to the complexity of the humans in terms of their biology, emotions, and the behavior, which is also known as a genome complexity conundrum. So in the human transcriptome, approximately 4 million messenger RNAs come from the gut microbiota, and this has been called as the second genome. So colonization by the gut microbiota occurs at birth. So when babies acquire complex bacteria as they pass through the birth canal, so the benefit of the normal deliveries cannot be overemphasized here. So that is the reason why it has been made that better to avoid cesarean section, because the baby is going to benefit from the gut microbiota. So therefore, the infant gut microbiota composition shares obvious maternal characteristics for a time after birth and gradually changing to become more individualized at about 1 year. So a healthy individual has at least 160 kinds of dominant gut microbiota. So although there are individual differences in the terms of the gut microbiota species, the dominant species are basically the same. So more than 90% are the firmicutives and the bacteroids, which are typically all human bacteroids, apart from the Porphyromonas, Clostridium, and the Eubacterium. So other less abundantly present bacteria are the Actinomyces and the Proteobacteria and the Methanogenic RK. So we have three different kinds of gut microbiota: the beneficial bacteria, the harmful bacteria, and the opportunistic bacteria. So the beneficial bacteria are the bacteria which inhibit the harmful microorganism. They enhance the immunity, promote absorption, and synthesize vitamins, inhibit tumors, reduce infections, and also relieve allergic reactions. They are the lactobacillus and the bifidobacterium. Whereas the harmful bacteria are the ones which can produce toxins. They increase the incidence of cancer and also induce infections. They are the Staphylococcus and the Salmonella campylobacter. Then you have the third one, which is the opportunistic bacteria, that is the Enterobacter and the Escherichia and the Bacteroides. So what are the determinants of the obesogenic gut microbiota? So of course, our rampant use of antibiotics, Western diet, cesarean delivery, and all these alternative baby foods, all these are the determinant. So Zhang et al. Reported on the destructions of the gut microbiota, including the age, diet, and also the use of antibiotics, and stated that with increasing age, the beneficial bacteria in the intestinal tract decreases while the toxins produced by the harmful bacteria increases, leading to accelerated aging, homeostasis caused by the fat diet. So the reason why we need to take a balanced diet free from fat to maintain a good gut microbiota, not only to control PCOS, but also in the later stage, so that you can prevent your rapid aging and also can avoid little bit of the menopausal symptoms. So of course, the insulin resistance, hyperinsulinemia effect on all the organs cannot be overemphasized, and this to some extent can be modified by improving the gut microbiota. So now let us look like how these gut microbiota result in the development of PCOS. So looking at the mechanism, first is the energy absorption by the gut microbiota. So it has been found that the gut microbiota, they degrade the carbohydrates into simple sugars, and then they ferment them into hydrogen ions, the carbon dioxide, methane, and short chain fatty acids to provide energy to the host. So obese women, they take more energy from the food, which then aggravates the symptoms of obesity, causing a vicious cycle. Now, this phenomenon is associated with a disordered gut microbiota. So KAIN et al. Found that gut microbiota disorder in obese patients may increase the host energy intake by converting substances that cannot be utilized into substances that can be absorbed. So this short chain fatty acids produced by the fermentation of the carbohydrates by the gut microbiota, they can stimulate the release of the peptides in the ileum and the colon, which inhibits the intestinal peristalsis, decrease the secretions of the pancreas, and promote the absorption of energy in the intestinal tract. So Turnberg et al. Analyzed the gut microbiota of both the lean and obese mice with the same diet and found that obese mice, they have more firmicutes and fewer bacteroids than the lean mice, and that this distribution of the gut microbiota was able to absorb energy better. So however, after wild aseptic mice were given the gut microbiota transplant from the obese mice, their energy intake increased and they presented with symptoms of obesity. So the study confirmed the relationship between the gut microbiota, energy metabolism, and obesity, and thus gut microbiota disorders can accelerate the process of PCOS by affecting the energy absorption. Now, looking at the second mechanism, how the gut microbiota affects is by the short chain fatty acids. Now, the gut microbiota decompose the organic materials to produce three major types of short chain fatty acids, like the acetate, propionate, and the butyrate. Moreno Indias et al. Found that the gut microbiota diversity was reduced in the female rats exposed to high levels of androgen environment in 24 hours after birth, and that the risk of metabolic disease in the adulthood was increased. So therefore, it was concluded that gut microbiota affects the occurrence and the development of PCOS through the short-chain fatty acid pathway. Now, the third mechanism is by the lipopolysaccharide metabolism pathway. So these lipopolysaccharides, also known as the bacterial endotoxins, are a unique component in the cell wall of the gram-negative bacteria. So bacteroids and the E. coli in the human intestine, they are gram-negative bacteria. And after being absorbed into the blood, these lipopolysaccharides, they bind to the receptors like TOL4 on the surface of the immune cells by transmission of the lipopolysaccharide binding protein. Now, Zhu et al. Compared the level of this serum lipopolysaccharide binding proteins in PCOS patients with that of the healthy women, and found that this LBP level in PCOS patients were increased irrespective of the body mass, providing a strong evidence for the involvement of LPS in the pathogenesis of PCOS. So here, this description of how this LPS causes the PCOS by causing a leaky gut, that is, it affects the gut permeability, thereby release of endotoxin into the circulation and promotes the absorption of energy, and this results in the bioconversion of the bile acids and also the amino acid synthesis, which finally causes insulin resistance, hyperandrogenemia, and PCOS. So the next mechanism by which the gut microbiota affect is by the choline pathway. Now, the PCOS patients not only suffer from diabetes and obesity, but they also have an increased risk of heart disease. And studies have shown that gut microbiota may contribute to the occurrence and the development of the cardiovascular disease through the choline pathway, because choline is a very important chemical which is present in the cell membrane, and it is found to be a protectant. Now, our next mechanism by which the gut microbiota affects is by the bile acid pathway. So bile acids generally emulsify the fats and promote digestion and absorption of the fat-soluble substances in the gastrointestinal tract, while the bacteria are essential for the formation of the bile acids. Now, this gut microbiota, they regulate the bile metabolism through farneside receptors, vitamin D receptors, protein-coupled receptor for bile acid, and participate in the synthesis, metabolism, and the resorption of the bile acids. So studies have shown that gut microbiota affects the glucose and the lipid metabolism and chronic inflammatory states in PCOS patients by influencing the bile acids, leading to other endocrine disorders. So the next mechanism by which the gut microbiota affects is by the intestinal permeability. So this is the most important one, wherein you have the leaky gut. So here, generally, the epithelial cells are very closely packed. So, but when there is a reduction of this gut microbiota, these epithelial cells develop a space between them, and as a result, the toxins leak through these gap into the systemic circulation. And as a result, there will be a rebalance of gut dysbiosis, and this is the main thing. That is, the intestinal mucosal tight junctions are generally present at the edge and the top of the mucosal cell membrane, and they control the openings of the intracellular pathways, and they are the first line defense for the cellular bypass pathway. Now, these intracellular tight junctions are physiologically complete, but under certain pathological conditions, such as the oxidative stress or the inflammatory damage, their structure and the function can be destroyed. So studies have shown that the inflammatory factors can reduce the expression of these tight junction proteins, zonula occludent, and the occluding leading to the disintegration of the tight junction and increased intestinal permeability. That is called the leaky gut. Now, PCOS is a chronic inflammatory conditions, and the long-term low release of pro-inflammatory factors, they cause continuous damage to this intestinal permeability, and it is closely related to the contributions of the gut microbiota. Et al. Proposed that one of the pathogenic mechanism of PCOS could be that obesity, high glucose, high fat diet, low dietary fiber encourages the gut microbiota imbalance, thereby destroying the junction between the intestinal epithelial cells and reducing the expression of the ZO1 and the occluding chemical receptors. And in addition, the expression of the cannabinoid is inhibited, which can also act on the tight junction proteins, leading to the leaky gut. As a result, the process whereby the LPS enters the body circulation from the gram-negative bacteria accelerates, contributing to the antigen-antibody reaction in vivo, which activates the immune system, thereby causing chronic inflammation, which hinders the function of the insulin receptors and thereby increase the level of insulin, resulting in high levels of androgens and abnormal follicular development. So this is a beautiful description of the leaky gut. See, the normal gut will have this epithelium very closely packed together. So you have the good microbiota in the intestine. But when there is an imbalance, there is a disruption of these epithelial cells, which results in the gap between the cells, which causes the release of the endotoxin into the circulation and results in all the cascade of events which was described. Next, the final mechanism by which the gut microbiota affects is by the brain-gut axis. Now, this is quite interesting. Again, the brain-gut axis is the information communication system between the intestine and the brain, a neuroendocrine immune network which is formed by the central nervous system, intestinal nervous system, the HPO axis, and the intestinal tract. Now, this gut microbiota communicates with the host through the gut-brain axis via the immune, neuroendocrine, and the vagal pathways. So, under pathological conditions, the gut microbiota disorders can result in abnormal secretions of peptides, cytokines, inflammatory factors in the intestinal canal, which transmit informations to the brain. So after analysis and calculations by the brain, instructions are transmitted to the various organs as well as to the intestine and the gut microbiota. So more than 20 to 50 gastrointestinal hormones have been found to be involved in the brain-gut interactions. So gut microbiota and the gastrointestinal hormones are reduced in PCOS, thereby delaying the gastric emptying time, reducing appetite, enhancing satiety, and also promoting proliferations of the pancreatic islet cells, beta cells, and stimulating the insulin secretions. PCOS patients, they also have psychological problems of depressions, social phobia, anxiety, aggression due to this abnormal brain-gut axis. So a gut microbiota imbalance causes changes in the 5-HT secretions, that will be a decrease of it, which is mainly responsible for these changes. So having understood the role of gut microbiota in the development of PCOS, now let us look into the management of the PCOS, just focusing only on this because otherwise management is vast in PCOS. So let us confine ourselves only to this. So at present, the etiology of PCOS has not been clearly calcified, though we have also explained how this gut microbiota is one of the factors, but still still there are many things which are still not understood. So making it difficult to eradicate the disease due to the heterogeneity of the patient's age, the patient's demand, and the heterogeneity of the clinical manifestations. Now, the clinical manifestations must adopt an individual approach to treat the symptoms based on the patient's complaints, the demand, and the metabolic changes. So the treatment approaches include anti-androgens, maintain health, and improve the patient's quality of life. So currently there is no treatment plan which aims to regulate the gut microbiota, although it may be an effective approach to treat the PCOS in future. So we have the lifestyle intervention. It has been found that there is a lifestyle intervention which is the primary treatment for PCOS, and it focuses mainly on the diet, the exercise, the behavior, psychology, and also on the other channels as a first line treatment. So this focus mainly on the behavior, psychology, and all other aspects which has been found to affect the activity of the gut microbiota and thus regulate the metabolism of the host. That is when how lifestyle affects the gut microbiota. So the dietary changes can rapidly change the relative abundance and the species in the gut microbiota, something that has been confirmed in patients with metabolic syndrome. So a very high fat diet, high sugar can result in gut microbiota disorders, leading to the increased intestinal permeability, endotoxinemia, hyperandrogenism, ovulation disorder, leading to the increased intestinal permeability, endotoxinemia, hyperandrogenism, and ovulation disorders. Therefore, strict dietary controls are needed. So a recent meta-analysis revealed that exercise can improve the level of FSH, sex hormone binding globulin, total testosterone, and androgen level, and reduced modified Fermin-Galware score for hirsutism. So more and more attention has focused on the relationship between exercise and gut microbiota, and Clark et al. Compared the composition of gut microbiota in athletes with general population and found that sports can increase gut microbiota diversity. Quite interesting. So that is the reason I generally ask all my patients, adolescent girls who come with obesity, to just get into some sports, which would be an easy way to kind of overcome most of these issues. Mika et al. Studied the effect of exercise on gut microbiota in rats and found that compared to a normal active group, the gut microbiota diversity in rats increased after 6 weeks of wheel running. Interesting, isn't it? Physicians should encourage PCOS patients to do aerobic exercises at 60 to 80% of the maximum heart rate for more than 30 minutes at least 4 times per week. So cognitive behavior therapy can improve the psychological fatigue of patients with PCOS. So given the bidirectional signaling pathways of the brain-gut axis, it was speculated that an improvement in the emotional brain activity pathway could also affect the gut microbiota and the intestinal homeostasis. This is something very interesting which I found, that is the fecal microbiota transplantation. That is, they take the feces from the healthy individual and transplant to the PCOS, is what is the concept. Fecal microbiota is a method whereby organisms from the feces of the healthy donors are introduced into the small intestines of patients through nasogastric tube to directly and rapidly change the composition of the new host gut microbiota and treat the disease. So Wilson et al. Transplanted the gut microbiota of healthy donors into the patients with metabolic syndrome, and they found that after 6 weeks, the insulin sensitivity of the recipients had increased. So at present, there are no clinical reports on the use of fetal microbiota therapy, transplant therapy, to treat gynecological diseases. So fecal microbiota transplantation can be an important new approach to treat PCOS in the future, but further study is required in this concept. Next would be the probiotic therapy. So probiotics are generally defined as the live microorganism that when administered in adequate amounts confer health benefits on the host. So traditional probiotic therapies are generally lactobacillus, which can significantly improve the insulin resistance, increase the satiety, and also promote intestinal gluconeogenesis, reduce the fat accumulation, and decrease inflammations in the rat with alcoholic fatty liver disease. So can a macrogenic level, on a macrogenic level, it has been found that it returns the gut microbiota severely affected by high fatty diet to the normal state. So a randomized double-blind control experiment confirmed that combined with a placebo group, the probiotic supplementations with Lactobacillus acidophilus and Lactobacillus casei and the Bifidobacterium bifidum significantly increase the serum levels of the sex hormone binding globulin, reduce the total serum aldosterone level, reduce the Ferriman Galway scores, and also improve the chronic inflammatory states as indicated by the decreased level of the CRP and the MDA concentrations. So no adverse effects of the probiotic supplementations were observed. The next would be the prebiotic therapy. So the prebiotics are non-digestible saccharides, which are defined as a selectively fermented ingredients that allow specific changes both in composition and activity in the gastrointestinal microflora that confers benefit upon the host well-being. So Silvers et al. Found that adding prebiotics increase the quantity of the bifidobacterium and promote the secretions of GLP-1 by the colon cells, thereby improving the insulin resistance. So inulin, which is a prebiotic extracted from the chicory roots, can improve the intestinal microecology and the physiological functions. So this suggests that inulin improves the metabolic and the inflammatory status of PCOS by regulating the gut microflora similar to that of metformins. Finally, we come to the Chinese medicine. A number of polysaccharide compounds have also been shown to promote and regulate the growth of intestinal probiotics in mice, including the Chinese yam, dogwood polysaccharides, and mulberry leaf polysaccharides. So as part of the treatment of PCOS, fecal microbiota transplantation supplementations with probiotics, traditional Chinese medicine can be used to treat the gut microbiota and thereby treat PCOS, which is all, quite a lot of research has to be still done on these aspects. So it has been also found that the gut microbiota improves when you add them to that of other treatment of PCOS, other molecules like myoinositol and dichloroinositol, and the addition of the lactobacillus improves the myoinositol absorption. So thereby reducing the plasma, a significant increase in the myoinositol level have been noticed with the addition of this microbiota. So this is a study wherein 37 anovulatory women were given myoinositol 2 grams twice daily, and then they ovulated, about 62% ovulated and 83% there was an ovulation, but with addition of lac, that is a microbiota, 12 ovulated again, and totally 35 ovulated. So the addition of the microbiota along with the myoinositol improved the ovulation rate. And also it helped in decreasing the hyperandrogenism, thereby improving the folliculogenesis. So another aspect apart from PCOS, just for completion's sake, where it has been found to be useful is in the menopausal women, where it is found to improve the vulval dystrophies. This is a paper where they found that vaginal microbiota has been found to be quite effective in vulvovaginal atrophy and also in the treatment of the postmenopausal osteoporosis. This is how it works. So to conclude, conclude, despite being an exogenous genetic material, the gut microbiota, the intestinal flora regulates expression of host genes, leading to the occurrence of the PCOS. Thus, it is imperative to further detect and analyze specific functional bacterial profiles related to the occurrence and the development of PCOS. Moreover, there is a need for further research to determine whether the manipulation of these intestinal microbiota can be useful in the treatment of PCOS. So I would like to conclude my presentation by stating that experience without theory is blind. But theory without experience is just mere intellectual play. So lots of theories have really been coming up with PCOS, and we are also looking for more evidence on these management protocols. So thank you so much for your patient listening. And I would like to take this opportunity to thank Shield Pharma for this academic activity. So now I'm here open for questions.
Yes, ma'am. Thank you. Thank you very much for your excellent presentation, ma'am. The presentation was very much in detail, ma'am. And yes, ma'am, of course, there are growing evidence that this gut dysbiosis is associated with pathogenesis of both intestinal and extra-intestinal disorders also, ma'am. There are many recent studies which has been studied on autism and gut dysbiosis on oral health. Even this dental doctors have started using this probiotics and all for probiotics. Thank you, ma'am. Thank you for this wonderful presentation, ma'am. And let me wait for 1 or 2 minutes for the participants to post their queries, ma'am.
Yeah.
I'll read out if there is any questions
Yes,
from the
sure.
participants. Yes. Ma'am, there is one question like, what are the symptoms to be watched in gut dysbiosis, ma'am?
Yeah, so the leaky gut, no, they will have loose motions, colic, abdominal colic, indigestions. So all those things will be one of the symptoms.
Okay, ma'am.
Symptoms, in fact.
Yes, ma'am. There is another question like which
And
I
of
think
course, the obesity, all other features of PCOS will also be definitely be associated with it.
Yes, ma'am. Ma'am, there is another question. Hope you have answered, I guess, ma'am. So, how does gut health come into play during perimenopause and menopause, ma'am?
Which one? How?
How does gut health come into play during perimenopause and menopause, ma'am? Perimenopause and menopause.
Yeah, see, that's what it causes vulval dystrophy. It aggravates, that is the less of the gut microbiota will causes more of, I mean, it will worsen the hypoestrogenic condition and will cause quite a lot of vulval and vaginal dystrophy. And apart from that, it also seems to be affecting the bone metabolism. So as a result, in postmenopausal women, it will enhance the bone resorption and more chances for acceleration of osteoporosis. So it is mainly important for the bone health and also for the all the vulvovaginal atrophies which are associated with menopause.
Thank you, ma'am. Ma'am, the next question is, can dysbiosis cause weight loss, ma'am?
Dysbiosis causes weight loss.
Weight loss.
Yeah, sometimes because if they're not having other symptoms, just with a leaky gut, it will be like an irritable gut syndrome. So they will be having quite a lot of only irritable bowel movements, which will kind of cause weight loss also. It can either present that way, or it can also present with obesity because of the associated PCOS. See, this gut dysbiosis not only causes PCOS, it affects all the metabolic disorders. And PCOS is one among them.
Okay, ma'am. Ma'am, how long the treatment has to be taken to bring this dysbiosis to normal, ma'am, eubiosis?
See, we don't have enough literatures on that. I don't think so anyone has done much study on that. So I'm not very sure. Maybe I think 2 or 3 months, we may have to put them on these.
Okay, ma'am. And
I
ma'am,
haven't seen any papers on that.
Okay, ma'am. And what will be your advice on food and lifestyle modification for this particular gut dysbiosis, ma'am? What type of
Yeah.
food has to be taken?
Yeah. See, basically, it has to be a high fiber diet. That is very clear, and less of fat. So the fat is a major culprit. So because of the excess fat, only the microorganism in the gut get disturbed. So to neutralize that, you have to reduce the fat and also reduce the sugars and improve the protein and the fibers. So with that, the gut microbiota improves. So that should be our lifestyle. That is diet. Mainly diet and exercise will be the primary first line of management. So low fatty diet, low carbohydrates and low sugar diet, and increase in the fiber diet.
Okay, ma'am. Ma'am, last question is like whether this alpha lactalbumin will be safe in ART procedures, ma'am.
Yeah,
Whether we
it's
can use.
very, very effective. See, because apart from all these things in ART, it is very, very effective because there is, that is a condition where we are worried, about the ovulation and all. So it helps to, most of these patients will have hyperandrogenism. So because of that, they are having defective folliculogenesis. See, when you even sometimes they may ovulate, but then because of the hyperandrogenic environment, the quality of the oocytes can get compromised. So to at least to reduce that, if you add these gut microbiota, all these lactobacillus to that, they will help to reduce the hyperandrogenic conditions, thereby making them very sensitive to insulin, and they can improve, reduce the testosterone, aldosterone, androgens, and improve the follicular development, and you will have better quality of the oocytes. Especially in ART procedures, I think it is mandatory to add these gut microbiota. So see, now most of the companies have come out with the combinations. That is, they add these gut microbiota along with your myoinositol, and also even with metformins, it have been added. So they have also found that even in PCOS, while they are using all these oral contraceptive pills, like all these Dian 35s and all those things, if you add gut microbiota to them, the effect has been found to be better rather than just giving them only the oral contraceptive pills.
Thank you, ma'am. Ma'am, I don't find any other questions in the chat box, ma'am. So if you allow us, then we can end the webinar for today, ma'am.
Yeah. Okay, right.
Yeah,
fine.
ma'am. Thank you, ma'am. Thank you very much for your presence with us today, ma'am.
Yeah.
You have spent your precious time with us, ma'am. And I would like to thank the participants also for joining with us today. On behalf of Shield, I would like to thank all the colleagues which made this webinar possible, ma'am. Thank you, ma'am. Thank you very much, ma'am.
Thank you so much, Dr. Stalin, and thank you so much, Shield Pharma, and thank you all my dear colleagues and friends who have attended this program.